Welcome back, everyone. Today, we're jumping right into the nuts and bolts of HIPAA security compliance. Now, I know, hearing the word compliance might immediately make you think of dry, endless bureaucratic chores. But let's completely flip that perspective today. Instead of a chore, I want you to think of your HIPAA compliance plan as your ultimate defensive playbook. Seriously, it's the vital armor protecting everything your healthcare organization has worked so hard to build. Let me ask you this directly. What actually happens when a hospital makes the evening news for a data breach? Well, it's pretty much every administrator's absolute worst nightmare. You see, bad press like that doesn't just mean a few awkward days around the water cooler. It permanently shatters public trust. Patients see those headlines and, quite frankly, they just take their care somewhere else. So you're not just losing data. You're losing community respect and patient retention in a flash.
And then, of course, there are the financial stakes. Just look at this number, $28 million. That was the staggering, record-setting total back in 2018 for the Office of Civil Rights Civil Monetary Penalties. Falling short of the HIPAA security rule requirements? Yeah, that isn't just a slap on the wrist. It can literally mean massive financial ruin and, in the most extreme cases, actual prison time. Okay, let's dive into this explainer. We've got a clear roadmap today to turn these dense regulations into a practical defense strategy. We're going to cover the high stakes of HIPAA, building a compliance plan, auditing versus monitoring, the 8-step audit process, and finally, facing the OCR. Starting right off with Section 1, the high stakes of HIPAA, and building a culture of compliance. The absolutely critical thing to grasp here is that compliance simply cannot be put on the back burner. Building this mandatory culture requires real, dedicated resources. And by that, I mean actual staff and actual budget. You've got to proactively spot and mitigate risks, whether that means installing fire suppressants for natural disaster or locking down robust firewalls to keep hackers out. But honestly, the biggest piece of the puzzle is your workforce. They have to feel 100% comfortable asking for help. Because if someone's confused about how to safely handle data and they're too scared to ask, well, they might just accidentally upload protected health information right to the open internet, and nobody wants that. Moving into Section 2, building a compliance plan, which really acts as your proactive shield. So, the Office of the Inspector General essentially recommends a plan built around these 7 fundamental elements. Think of these as your bedrock. You need written policies, a designated compliance officer, nonstop training, effective communication, monitoring, strict enforcement, and crucially, a prompt response to any slip-ups. To put that last one into perspective, if you suffer a breach impacting more than 500 patients, that prompt response literally requires you to notify the media and the Secretary of HHS as soon as possible, and absolutely within 60 days. No exceptions. Right at the helm of this whole operation is the Chief Security Official, or the CSO. But, and this is key, they do not run this massive program on an island. As an executive-level leader, they lean heavily on an advisory committee. This team is basically a brilliant cross-section of your entire organization. You've got IT, health information management, risk managers, legal counsel, the whole group working collaboratively to oversee everything from pulling access when an employee leaves all the way to overarching risk management. Here's the thing, though. A compliance plan completely falls apart without effective communication. If you just hand down a bunch of rigid thou shall not mandates, your employees are going to tune you out instantly. True communication means engaged listening. It means picking up on nonverbal cues, like if someone's totally distracted by their phone, and managing the intense stress of a security confrontation. Bottom line, your staff are infinitely more likely to follow the policies when you take the time to clearly explain the why behind the rules. Now, what's really interesting about this next part, Section 3, auditing versus monitoring, 2 vital components. These are without a doubt 2 of the most frequently confused terms in the entire security compliance playbook. So think of the difference like this. Monitoring is your security guard doing their daily rounds. They're assessing established controls and checking compliance in real time. Auditing, on the flip side, is your detective. It's that independent review and retrospective reconstruction of past events to figure out exactly who executed what, why they did it, and what changes were made. And audits themselves actually break down into 2 main collaborative camps. First, you have internal audits. These are performed by your covered entity's own staff, sometimes daily, weekly, or monthly, just making sure day-to-day operations align with policies. Then you have external audits. These are handled by hired outside consultants, usually on an annual basis. And their whole job is to confirm that your internal team hasn't developed blind spots, ensuring those internal audits are actually, doing what they're supposed to do.
When those auditors finally get to work, they're looking through three very distinct lenses. A process audit confirms tasks are meeting standards, like verifying if 100% of your security triggers were actually reviewed. Next, a product audit evaluates services, basically making sure that highly expensive network firewall you bought is actually blocking malware. And finally, a system audit reviews overall effectiveness. This would be like investigating your entire training program to guarantee HIPAA documentation is actively present and ongoing. Which brings us to Section 4, the 8-step audit process. It's a highly structured life cycle. An audit really isn't some random fishing expedition. You can trace a very clear logical journey. You start by identifying risk areas. Then you determine the frequency, schedule it out, notify the departments, prepare, conduct the actual audit, record the findings, and report the results. But notice the arrows here. It's a cycle. Because as healthcare organizations and regulations naturally evolve, new risks pop up, which means this cycle has to immediately kick off all over again. When auditors are out there doing the field work, they are actively hunting for proof across three main safeguard types: administrative, physical, and technical. To actually prove compliance, they gather objective evidence, like checking your system logs to confirm you're using encryption for data transmission. Or they'll use direct visual observation. They will literally walk around your office to make sure computer monitors are physically turned away from public view. And this brilliantly illustrates a really crucial distinction for us: the difference between a metric and a threshold. A metric just tracks progress, right? Like counting the number of visitors logged at a data center. But a threshold is your desired performance level for that metric, say hitting 98% compliance. Without setting reasonable thresholds, analyzing your metric data yields absolutely no actionable value. Plus, if you set the threshold at 100% and it's completely unreachable, your employees are just going to get frustrated and give up. Which brings us to arguably the most famous mantra in all of healthcare: if it's not documented, you didn't do it. This highlights just how absolutely critical the record findings phase is. Whether you're relying on automated audit trails or manually typing data into spreadsheets, the quality of that data must be impeccable. Because you know the old saying, garbage in, garbage out. If your data quality is poor, the resulting compliance information is literally worthless. All right, moving into our final part, Section 5, facing the OCR, which really is the ultimate test. This is the moment where all your hard work gets officially tested by the government. The Department of Health and Human Services Office of Civil Rights, the OCR, is in charge of oversight here. Now, originally, they only audited you if someone filed a complaint. But thanks to the HITECH Act, covered entities and business associates can now be hit with random desk audits or on-site compliance reviews at literally any time. You don't get a heads-up warning. You just get a formal notification that it is time to hand over your documents. Now, if a specific complaint is what triggers the OCR, they follow a very strict intake and review process. They will rigorously check all the boxes. Was the alleged behavior actually done by a covered entity? Does it truly violate the privacy or security rule? And crucially, was the complaint actually filed within the 180-day window from when the issue was first identified? After that review, the OCR essentially takes one of 5 paths. They might just close it if there's no real issue, or they might opt not to investigate at all. Sometimes they investigate and find no violation, but very often they provide what's called technical assistance. And don't let the friendly name fool you, that generally mandates immediate sweeping changes to your compliance program. Or they might push for formal corrective action. When things really go south, it usually results in a resolution agreement. This is a document that plainly details your compliance failure and slaps you with those heavy civil monetary penalties we talked about earlier. It also outlines a mandatory corrective action plan, or a CAP. Being under a CAP means your organization is placed under intense, strict oversight. You're given hard deadlines for things like brand new risk analyses, and you have to continuously report your progress directly back to the OCR. It's a huge undertaking. So, as we wrap up today's explainer, I want to leave you with a provocative question to chew on for your own organization. Is your compliance a one-and-done event, or is it a living, ongoing culture? Because if we've learned anything today, it's that true security requires constant vigilance, endless communication, and a defense plan that literally never sleeps. Thanks so much for joining me today, and keep that shield strong.